Get real-life insights and actionable advice from those who've been there. We'll explore the perfect blend of academics, clinicals, and real-world healthcare experiences. Classroom. Master theoretical knowledge and clinical concepts. Lab practice. Develop hands-on skills in controlled settings. Clinical rotations. Apply learning with real patients under supervision. Diverse backgrounds. Students range from recent high school graduates to career changers in their 40s and 50s. Academic load. Full-time students typically take 3 to 5 intensive classes per semester with lab components. Multiple roles. Nursing students serve as learners absorbing knowledge, caregivers providing comfort, and advocates speaking for patients. 5 a.m. Wake up, prepare uniform, pack supplies and lunch. 6:30 a.m. Arrive at clinical site for pre-shift chart review. 7 a.m. Listen to night shift handoff and review new orders. Patient breakfast. Help serve breakfast trays to patients at 7:15 a.m. Check dietary restrictions. Comfort measures. Assist with hygiene, positioning, and basic needs after meals. Medication prep. Organize medications with instructor supervision. Review administration times. Morning vital signs. Take temperature, pulse, respiration, blood pressure, and oxygen levels. Head-to-toe assessment. Systematically check each body system for abnormalities. Documentation. Record findings in electronic health record with instructor verification. Doctor rounds. Listen and contribute to morning physician visits. Team huddle. Share patient updates and collaborate on care plans. Documentation. Record all interactions and interventions accurately. Medication management. Prepare treatments based on physician orders. Medication administration. Practice the 5 rights of medication safety. Vital sign monitoring. Track patient status throughout shift. Emotional support. Provide comfort and reassurance to anxious patients. Urgent care. Critical needs and time-sensitive interventions take highest priority during clinical rotations. Scheduled tasks. Medications, treatments, and procedures must be completed at specific times. Documentation. Thorough charting and record-keeping ensures continuity of care. Routine care. Comfort measures and basic needs form the foundation of patient care. Hands-on guidance. Instructors provide real-time technique correction and support. Immediate feedback. Receive constructive criticism to improve patient care skills. Experience mentorship. Shadow seasoned nurses to absorb clinical wisdom. Classes per term. Intensive courses combining theory and application. Class hours. Typical daily schedule when not in clinical. Clinical hours. Weekly hands-on hospital training. For insertion practice. Students develop precision and confidence with realistic venipuncture models before clinical rotations. Emergency response training. Team-based simulations prepare students for critical situations requiring quick, coordinated care. Wound care skills. Mastering sterile technique and dressing procedures using high-fidelity simulation models. Simulated hospital environment. Realistic settings help students transition smoothly from classroom to clinical practice. Individual study. Dedicate 2 to 3 hours daily for reading and review. Study groups. Meet weekly to discuss complex concepts and quiz each other. Online resources. Utilize virtual simulations and practice quizzes. Practice tests. Prepare for NCLEX with sample questions regularly. Time management. Use digital or paper planners to track assignments, clinicals, and exams. Set specific study hours and stick to them. Self-care. Schedule me time for exercise, hobbies, and relaxation. Prioritize sleep despite demanding schedule. Support systems. Connect with classmates who understand your challenges. Communicate needs to family and friends. Academic intensity. Complex material requiring deep understanding. Emotional toll. Witnessing suffering and providing compassionate care. Balancing act. Juggling clinical hours, study time, and personal life. Organization systems. Color code subjects and use digital reminders for deadlines. Early intervention. Address academic struggles before they snowball. Use office hours. Stress management. Practice mindfulness, exercise, or journaling to process experiences. Clinical reasoning. The most essential skill, 95-100, enabling nurses to make sound judgments based on assessment data and patient needs. Communication. Vital ability, 90-100, to clearly exchange information with patients, families, and healthcare team members. Time management. Critical competency, 85-100, for prioritizing care tasks and managing multiple patients effectively. Teamwork. Important capability, 80-100, to collaborate with interdisciplinary healthcare professionals for optimal patient outcomes. Adaptability. Valuable trait, 75-100, allowing nurses to respond effectively to rapidly changing clinical situations. Classroom learning. Clinical application. Study heart failure pathophysiology. Recognize symptoms in actual patients. Memorize medication information. Administer real medication safely. Practice therapeutic communication. Comfort anxious patients effectively. Learn documentation standards. Chart accurately in electronic health records. Morning assessment. Discover diabetic patient struggling with post-surgical pain. Intervention. Collaborate with nurse to adjust pain management plan. Patient teaching. Explain wound care and diabetes management at home. Emotional support. Listen to fears about recovery and provide reassurance. New student. Uncertain about skills. Hesitant with patients. Mid-program. Growing confidence. Building technical proficiency. Near graduation. Clinical judgment developed. Comfortable with patients. Ready for practice. Professional identity formed. Prepared for licensure. Career research. Explore nursing specialties and job markets. Consider graduate programs. Professional networking. Connect with nurses during clinicals. Join student nursing associations. Job preparation. Create nursing-specific resume. Practice NCLEX questions daily. Career research. Explore nursing specialties and job markets. Consider graduate programs. Professional networking. Connect with nurses during clinicals. Join student nursing associations. Job preparation. Create nursing-specific resume medical surgical. 25% of registered nurses work in this foundational specialty. Critical care. 18% of RNs specialize in intensive and critical care settings. Pediatrics. 12% of nurses focus on caring for children and adolescents. Obstetrics. 10% of nursing professionals work in maternal and newborn care. Emergency. 8% of RNs thrive in fast-paced emergency departments. Other specialties. 27% work across diverse areas including public health, psychiatry, oncology, and more. Practice NCLEX questions daily. Build your network. Form study groups and connect with practicing nurses. Ask questions. Clarify concepts early. There are no stupid questions. Share knowledge. Teaching others reinforces your own understanding. Patient focus. Remember the person behind the diagnosis. Global impact. Shaping the future of healthcare worldwide. Community service. Improving health outcomes locally. Patient connection. Touching lives one person at a time. Rigorous study. The academic journey builds knowledge you'll use every day. Practical skills. Clinical experiences transform theory into life-saving abilities. Rewarding career. Your perseverance creates a meaningful profession that changes lives.